now the country's, oh yeah, that's what they do, that's your glasses, but you look like you're vaping.
I know. You
Our
see, I don't
Lucy,
know.
she said she thinks it looks like adult dummies.
Yeah, she's right.
Like sucking on a dummy in a sort of needy nursing kind of way.
And I don't wish, honestly, if you're a vapor, I don't wish to mock you in any way, because I do think it's an addiction, really. And we all have certain addictions, I'm sure. But the country's top paediatric doctors, these are doctors for young people, have issued a warning suggesting that youth vaping is becoming an epidemic amongst children.
They've actually called on the government to ban disposable vapes, and many thousands of people in the UK have already stopped smoking with the help of the e-cigarette, but we're asking whether they actually do really need to be banned. Or
should we be prioritising the health and well-being of our young people? This morning we are joined by Professor Sheriff Sultan. The professor believes vaping needs to be banned immediately, and evidence suggests the brain in adolescence is more sensitive to the effects of vaping.
Meanwhile, Director of Research at the Adam Smith Institute, Maxwell Marlowe, thinks the notion of banning vaping is ludicrous. Well, let's get the medical case, first of all, from the professor. Certainly a compelling argument that, you know, this is hugely detrimental to our young people.
That's for sure. And we are looking at a guess estimate that become a factoid. So let's go back to how we came at that vaping is safer 95% than smoking. It was a paper published in 2014 that the Public Health England that followed. This paper was totally debunked in the Lancet and the British Medical Journal, been written by people from the industry, sponsored by the industry. And they claim that vaping is 95% safer. It's not safe. There's a huge amount of problems. Kids, for example, however, for adults, the formaldehyde from the heating of the coil is 15-fold increase in cancer. More than that, the vaping itself causes an inflammatory reaction in the body and causes 3-fold increase in normal, healthy people of stroke and heart attack. So it's not safer, and we have to find an alternative to this way. In Australia...
Professor, could you tell me, when we're talking about children, I mean, I just wasn't aware that this was an issue with kids. Is vaping widespread, and what age group or how far down does it go, Professor?
15% of kids between the age of 9 and 15 vape. And it's a disaster because it affects their brain development, and the flavor in it is a disaster. And you could see your Prime Minister went on that his daughter is seduced by the coloring and the marketing of the vaping. We can't. Can you imagine you have a 14 or 15 years old kid in the house, whether a boy or a girl, having a vaping, and because he can't smell it, you allow it, and she can't concentrate or he cannot concentrate, they can't do their exams, and at the same time they've been addicted to something that will transform to full-blown smoking within 2 to 3 years whenever they're above 18.
Right. Well, Maxwell, you're shaking your head. Just explain why you think it's ludicrous to ban something that is full of formaldehyde and is leading to an increase in cancer.
Well, I'd like to have whatever the professor is smoking. There's no evidence that mainstream vapes contain formaldehyde. In fact, the thing that contains formaldehyde are cigarettes, which is exactly what vapes are there to get people off. Now, I will say that the professor is absolutely correct that children should not be vaping, and that there are some people in the industry who are purposefully targeting children with colourful advertisements and just misleading practices. Don't get me wrong, they need to be cracked down upon. But what you cannot doubt for one moment, and the Khan Review, which is the government's real anti-smoking review, really does show, with a lot of scientific backing, a lot of peer-reviewed studies, that vaping is the better alternative to smoking. Now, if you can stop children from vaping, and that's the role of parents, and that's the role of a responsible shopping community, which actually we don't have in many corner stores around the country, then that's a better thing to do. But the problem is, if you can, stop children from vaping, like you can try and stop them from smoking, which they were doing beforehand, and the professor is absolutely incorrect to say that vaping turns into smoking, there is no statistical evidence to actually show that, then well done. You've solved a real public health concern. But if you ban vaping, you'll get people back onto smoking. And smoking, people are addicted to the nicotine. They're not addicted to the tar and the chemicals that they're putting into their lungs. The reason the government is really leading the world in its vaping strategy is because it realizes the science, and the science is so straightforward. Vaping is 95% less harmful than smoking is.
Well,
and there's a lot of studies around the world to show that.
So Professor Chris Whitty doesn't agree with what you're saying, and he advises the government. You talk about the government understanding the science. He's their chief medical officer. He's very concerned about vaping, isn't he, Professor?
Yeah. Now the guess estimate have become a factoid. Factoid will keep repeating something until becoming a truth, which is not. The whole idea is built on one paper in 2014. Read the Lancet, and the Lancet was very clear. This paper is totally debunked. We must not say it's safer than smoking. The formaldehyde, hidden formaldehyde from the heating coil, is a hidden carcinogen, goes directly to the lung. What are you talking about? Read. Look at the publication. Why you are single-minded, single way?
Other anti-cancer societies who recommend smoking is removed from society by vaping. It is so clear. It is so clear from a number of large medical societies that it is the better option, and to ban it is to essentially subsidize smoking for the public, which is something that we do not want to have.
Would you worry about the environmental aspects of these disposable vapes?
Absolutely, yes. There's a real concern about how those batteries are used, how those batteries are basically disposed of. We, as a society, we have a real structural problem in our supply chains for recycling those batteries, and there needs to be more concerted action by government to encourage people to better dispose of those batteries. And the industry as well is looking at this too. A lot of the swap-in schemes. We, for example, advocate that councils should put in the bins that you see, for example, around the country, not just areas to put your cigarette butt, but also areas to put your disposable vape.
Okay,
that is
we
a better
understand
way
that.
of recycling.
Gentlemen, we've got to pause for breath now, not just because of vaping. We've got to hit a break. But very good and very interesting talking to you. You've put both sides of the argument, and we would like our viewers and listeners now to add their views, and we'll discuss those as the programme progresses. Gentlemen, thank you both very much indeed.